start. I'd like to introduce Anthony from North Carolina. Thank you for joining me, Anthony.
Absolutely.
Now, you're telling me that you take LDN for Common Variable Immunodeficiency. Could you tell us a bit more about that, please?
Yeah, I'd be happy to. Common Variable Immunodeficiency, or CVID, is a disorder of your immune system where your own body does not produce enough antibodies for diseases, infections. And there's different common variable immune disorder. Even though it's common, it's very hard to diagnose if you're not if you're not seen by the correct physician, so to speak, that understands it. I'm 46 years old, and it took 40 years for me to be diagnosed, and that seems to be about roughly the age that a lot of adults get diagnosed, and they're starting to diagnose it earlier in childhood after birth. But now that it's becoming more known in the immunology world, more and more adults are being diagnosed with it. My specific portion of CVID, I do not produce enough antibodies to fight off infections, and by not having the antibodies to fight off infections, you're a higher risk of cancers. I did have duodenal cancer that I had removed last year in April, and I'm happy to say I'm cancer-free in my last checkup. And a lot of the CVID patients will have either a lung type of cancer, lymphoma, or a gastrointestinal type of cancer. And the biggest reason that with my issue is I had a lot of gut issues growing up. I went from doctor to doctor saying, "Oh, you have IBS, you have never was diagnosed with Crohn's, you have celiac sprue, got tested for that." Well, actually, when I turned 40, did not have that, and just years and years of just constant being sick with sinus infections, ear infections, pneumonia, and nobody ever knew what was wrong. I was tagged as, "Oh, I have IBS and chronic sinusitis." Well, what do you do with that? You just try to avoid certain foods and try to stay healthy. Well, it got to a point where when I hit 40, actually on my 40th birthday, 5 days after, I had severe pain in my left side of my right below my stomach. Come to find out, I had a stricture in my intestines, and over I'd say about a 6-month period of time, having biopsies and stuff, I went to an oncologist, and was not necessarily diagnosed with lymphoma, but had just some questionable immune levels, and was referred to an immunologist out at Duke that specialized in different immune issues, and met with him for about an hour, and he said, "Oh, you have CVID." And it's like, where have you been for 40 plus years? And it just is the right doctor, and that's the struggle that you'll find with a lot of the patients that I'm on, with a lot of the groups I'm on, is it's not well known enough for common doctors, physicians, even immunologists that know about CVID. And there's some tickers for as far as different when you're talking to a doctor, different symptoms that you have. But the biggest test is your blood work. And to go into that is you have main antibodies. You have IgG, which is your overall. I'm not a doctor, so excuse me for explaining this, but in a broad range, your IgG is your overall immune level, and it helps to overall fight off infections. And then you have IgA, which mainly resides in your sinuses and in your intestinal flora, that help fight off sinus and intestinal issues. I'm IgA deficient, so I do not produce the IgA antibody. So that's one strike against me. When I was first tested, my IgG level was 87. The normal range is between 800 and 1400. So that, right there was the reason I was getting sick all the time, because I didn't have enough antibodies to fight off infections.
Mhm.
So from that point, since 2007, I've been on IVIG, which is intravenous immunoglobulin. Globulin.
Mhm.
So that's made from human plasma, and it is basically a super dose of IgG antibodies. And since being on that, my IgG has gone up to normal range. Normal is different for everybody, so don't think that, oh, if I'm in 1,000, I'm doing great. Some people are still sick at that level. Everybody's different. That's what's so hard about this disease.
Mhm.
And I still was having gut issues. I was on prednisone for 5 years, and I hated it. It was a love-hate relationship with that medication. It helped my gut issues, but also, caused me to gain weight, have hot flashes, headaches, depending on the level I was on. And I found out about LDN through one of the Facebook groups for IBS, and I was amazed at how these people with Crohn's and other issues were having relief with this. And the biggest thing that all the people said on these posts was getting your doctors convinced to write a script for it. Well, fortunately, I came across a lady that had with an immunologist that I was already seeing at Duke. She worked in a different department but knew of her, and she said, if you can convince her, she's in a very detailed research study for CVID at the gene level, I think she will be, in tune to prescribing it to you. It took me about, I'd say, 2 months, giving her all the documentation that's on your website, and back and forth with emails. And she finally said, I've done some research. Looked at the documentation you've given me, and the benefits far outweigh the risks, if any. So I started on 0.5 milligrams. I was on that, and I slowly have been going up. And then I had to have another surgery due to my previous surgery to repair a surgical hernia, so I had to go back off of it. But since I've been on it, I've been off of prednisone since May, before my last surgery, and I have the gut issues I used to have, which were very boily stomach, a lot of gas and diarrhea. I don't have that anymore. It's totally totally has squashed that symptoms that I was having, and now I'm up at 2.5 milligrams, trying to see what the sweet spot, so to speak, is. And everybody's different. It seems like 3.5 seems to be optimal, and I just am so excited about my results, and so is my immunologist, that other patients that are on my CVID sites, I'm saying, hey, check out LDN. These are some links to check out, and I've posted it on my sites, and they're like, this is amazing, So it seems like a drug that's almost too good to be true, but the proof is in the patients, basically, is what I think. The results are there, and it's just the education of the physicians I think is the biggest barrier that I'm running up against, or seeing other people to run up against.
And what does your doctor say?
It's interesting. It's fortunate that with this disease, you have to have a team of doctors rather than just one individual primary care doctor and a GI doctor. You got to have a whole team that are all on the same page. And fortunately, I've been blessed to have that. It took some time, and they know that I am definitely a very rare patient, and in some instances rarer than some others with CVID due to other issues. But as far as the immunologist that is on board, she's really excited, and she's wanted me to keep her informed, which I have been, about the results from LDN, and wanting to get my wife on it for her fibromyalgia issues that she has, and we're on that path to get a new primary care physician that will prescribe it for her. But I have a compounding pharmacist that is very versed on it. very excited about it. And I passed his information on to you for the conference, Hamid. And I just really kind of like a poster child with the LDN, kind of like I was with CVID, and educating family members to be tested for it and stuff like that. So I'm very excited about it and what it's doing for me.
Well, what else can I say? You've said it all. It's absolutely amazing. And as I said before, it was the first time that I'd actually heard of common variable immune deficiency. So that's a good lesson. Thank you very much for sharing your story with us.
Absolutely.